Hello, everyone. It's Debbie Hatch from Pinnacle Personnel Services, hopping on today to do a live session. I almost said Friday Night Live, but it's not Friday, so I can't say that. What I'm going to do today is update all of the numbers regarding your federal retirement, your benefits, your Social Security, your Medicare, and things of that nature. Those numbers change generally in January of each year, and the new numbers end up coming out October, November-ish timeframe. So we have all of the new numbers for 2024. Unfortunately, if you're waiting for OPM to put those out there, they did their benefits administration letter updating the numbers for 2023 in November of 2023. So you have to wait 11 months to get the information. It's not very helpful. Hopefully, this is going to be a lot more timely for you and help you understand how things are going to change for you come January. I am going to start by talking about your health insurance. If you're a federal employee, your health benefits are under something called the Federal Employees Health Benefits, or FEHB. We just had our open season wrap up at midnight on Monday, so hopefully you had an opportunity to make any changes that you wanted to make for that open season. You're not going to have another one until the second week of November this coming year. It will go to the second week of December, just like it does every year. And outside of open season, you can only make changes if you have a qualifying life event. One of the things that changes in January for our health insurance is the amount that the federal government is going to pay towards those benefits. By regulation, OPM says that the federal government pays 72% of the weighted average cost of all of the health plans available across the entire country. And we have over 260 different health insurance plans that people can sign up for. For January, the government will pay up to $271.43. That's every 2 weeks if you are enrolled in a self-only plan. If you have a self plus one plan, the government is going to pay up to $586.50 every 2 weeks for you. And if you have a self and family plan, the government will pay up to $646.18 every 2 weeks for you. I say every 2 weeks because that's how our federal employees are paid. If you have retired from the federal government, you pay monthly, and the federal government continues to pay 72% of the weighted average cost of the health insurance even after you retire. If you're not aware of it already, that's a tremendous benefit. The cost changes a little bit for you for a couple of reasons. While you're working, you pay biweekly. You normally have 26 pay periods, and once you retire, you are paid monthly. So you only have 12 pay periods, but another reason is that while you're working, you're paying for your health insurance before you pay taxes, but after you retire, you're paying taxes before you pay health insurance. Short of that, the amount that the government is paying towards your health insurance remains exactly the same. Like I said, tremendous benefit. If you happen to be one of the employees who is healthy and willing to be enrolled in a high deductible health insurance plan where your premiums are much lower, your deductibles are substantially higher, those deductibles are raising in January to $1,600 if you have a self-only plan. If you are enrolled in a self plus one or a self and family plan, deductibles for those high deductible plans are going up to $3,200 come January. Out-of-pocket costs for these plans can be elevated as well. So you can see that's going to be $8,050 next year if you're enrolled in a self-only plan, and those out-of-pocket costs could be as much as $16,100 if you are enrolled in a self plus one or a self and family. When I teach my classes, I tell people the benefit of doing a high deductible health insurance plan, if you don't go to the doctors very often and you are willing to accept those higher deductibles, is that your premiums are lower. That's definitely a benefit. But also, with a high deductible health insurance plan, you're allowed to participate in a health savings account. And the only people that can do the health savings account are the folks that are in that high deductible health insurance plan. So this allows you to contribute money before you're paying taxes to your health savings account. And that money, unlike a flexible spending account, belongs to you. So you don't have to worry about use or lose. That health savings account money rolls forward from year to year to year, and it sits there for you. As long as you use it for medical expenses, you do not ever have to pay taxes on that money. The amount that you can put into your health savings account is increasing in January. It's going to be $4,150 if you are enrolled in a self-only plan, and it is $8,300 if you are enrolled in a Self Plus One or a Self and Family plan. Additionally, if you are going to be turning 55 or older, you're allowed to put another $1,000 above those limits into your health savings account. Like I said, this can be a great way for you to just accumulate a pot of money that you're going to have sitting there for your own medical expenses later on. Health savings accounts are yours. They don't have use or lose. You keep them. You can only contribute to them while you're enrolled in a high deductible health insurance plan. But if you decide to get out of that plan, your HSA doesn't go away. It belongs to you. Conversely, flexible spending accounts are available to all federal employees. You don't have to be enrolled in a high deductible health insurance plan to do a flexible spending account. These, like those health savings account, allow you to put money aside before you pay taxes. But for the flexible spending account, generally they're considered to be use or lose accounts, unlike that health savings account. And I say generally because we do have some money that we are allowed to roll forward from one use period to the next with the flexible spending account, but it's limited. So this year, you're allowed to contribute up to $100, that's an annual limit, as much as $3,200 if you're enrolled in a healthcare flexible spending account or a limited expense flexible spending account. The difference between those is what counts as a reimbursable expense. For healthcare, it really is anything except premiums. So you could use that for your deductibles, your co-pays, stocking your medicine cabinet, things of that nature. It's anything except for premiums. Limited expense healthcare flexible spending account is limited to only those people that are enrolled in a high deductible health insurance plan, and it is limited to reimbursing only dental and vision, but nothing else. The dependent care flexible spending account is the third one that we have. That one reimburses you for the cost of having someone cared for so that you could work. And that one is up to $5,000. The use period. So you sign up for these in the open season. Every year that you want to do one, you have to remember to sign up. It's not just one and done. It does require annual re-enrollment. If you are doing one this year and you also sign up to do one next year, then you're allowed to roll forward $640 from this year to that year. That's if you have a healthcare or a limited expense healthcare flexible spending account. So you really don't risk losing anything unless you have more than $640 in there at the end of the year. And that only happens if you're not paying attention, right? You don't have to max these things out, but you can put in something and at least save a little bit of money on taxes. Then the open season happens November to December every single year. You start looking at the amount of money that you have in your flexible spending account, maybe September, October-ish time frame, and you start spending that down so that you do make sure you don't have anything that you're going to lose as you move forward. The dependent care flexible spending account does not allow you a rollover, but there is a couple of months after the calendar year that you still have to spend your money. And let's face it, if you're paying for childcare, you're going to go through $5,000 very quickly, right? So you don't have to worry about rolling that over. There's nothing left in there at the end of the year. I will say that you can't have flexible spending accounts in retirement. So these are things that you want to take full advantage of while you are working. They will close down on your retirement date. So although that use period normally goes through the end of the calendar year, if I sign up for one in November, I retire in June, then it is important that I spend all of that money prior to June. I can file my claims for reimbursement after I leave, but I have to have accumulated those costs and those expenses prior to leaving. They do shut down on my retirement date, and I cannot sign up for a flexible spending account in retirement. Those go away. Medicare goes up pretty typically every year. I hesitate to say that because last year it went down just a tiny, tiny bit. There are 4 types of Medicare, if you're not aware of it. Medicare is administered by the Social Security Administration. It's not only for our federal employees, but it is for Americans. Medicare Part A covers inpatient care and hospice. We don't pay a premium for that. Generally, if we are working in jobs and we don't pay Social Security, something like CSRS, then we do pay a premium for that, but it's quite rare. Most of us are paying a Medicare tax out of our paycheck. And that Medicare tax is 1.45% of every one of our paychecks. So that money that's coming out in the form of a tax is going to cover the cost of our Medicare Part A. Like I said, that takes care of inpatient care and hospice. There aren't premiums for most of us because most of us are paying Social Security. The deductibles, though, can be substantial. So you can see for 2024, the deductible for Medicare Part A, first 60 days in a hospital, $1,632. If I'm in there for longer than 60 days, then there is a co-insurance fee of $408 per day up to the 90th day. And if I'm in there longer than that, it's $816 per day. So like I said, it's a pretty substantial deductible. And that's not an annual, that's per admittance. If I have another insurance, so as a federal employee, that could be FEHB. As a military retiree or family member, that could be TRICARE. If I have another insurance, then I don't have to pay that deductible out of my own pocket. My other insurance as the secondary payer is going to cover that for me. If I don't have another insurance, then yes, I may be covering the deductible and the coinsurance on my own. Medicare Part C is Medicare Advantage. You see advertisements for that on television all the time. That is Medicare through private insurance companies or different groups like AARP. Because they are private policies through various groups, they have different fees, charges, they cover different things. A lot of people call that a Medicare Advantage plan. You can look at that stuff once you are approaching age 65, which is when you become eligible for Medicare, typically, and see if you're interested in it. Most federal employees and most military retirees don't get Part C. They feel that they are fully covered with their Medicare A, B, and their TRICARE or their FEHB. I haven't forgotten Medicare Part B. I'm going to talk about that separately in just a minute. Okay, so A is paid through a tax, inpatient. C is Medicare Advantage. That is a secondary plan that I might get through one of these companies or through different groups. Medicare Part D is the type of Medicare that pays for prescription drugs. There is a fee for that as well, but it depends on where I live. It depends on what kind of scripts the doctor has written for me, and it also depends on the amount of money that I make, because Medicare Part D is incomes tested. So with that, again, you may or may not want it. If you are a federal employee, a federal retiree, or if you have TRICARE, you do not need Part D because all of the FEHB plans and TRICARE are considered comparable to Medicare Part D. You decide you want to get it later for some reason, you can, but you don't have to. And there's no penalty for late enrollment with Part D as long as you keep your other health insurance in place. Part B is the one that everybody has a lot of questions about because it has a premium, and that premium is based upon our income. Part B is the part of Medicare that pays the doctor's bill. It's the part of Medicare that is going to take care of the outpatient stuff as well. There's a deductible for this one, but it's quite low. It's $240 a year. Then, though, there is a 20% copay with Medicare Part B because they pay 80% of whatever is considered to be fair and reasonable. The premiums that we pay for Medicare Part B are based upon our earnings from 2 years prior. So when I go to sign up in 2024, what they're going to do is look back at my income taxes from 2022. If I am a single person filing an individual tax return and I had a modified adjusted gross income that is, I can't see it here, 103,000 or less. If I'm a married couple and I have with my spouse a modified adjusted gross income that is 206,000 or less, I pay the minimum amount for my Medicare Part B. Sorry, I don't have the numbers committed to memory yet. They just came out. The minimum amount that I'm going to have to pay for my Medicare Part B next year is $174.70. That is per person, and that is per month. So if my spouse and I are both over the age of 65 enrolling in Medicare Part B, then that's going to be times 2. Okay, so the deductible went up a little bit. The rates went up a little bit for Medicare Part B. The deductibles went up a little bit for Part A, and Part C and D. We're not going to talk about it because there are just too many variables to bring into the equation. Another thing that is going up in January is the interest rates that we have to pay if we are making a civilian deposit, a military deposit, or a redeposit. These interest rates are applicable to our CSRS employees if they do voluntary contributions as well. And what this is talking about, okay, what are all of these things? I'm not going to get into it because I am trying to limit myself to 20 minutes here. I want these small blurbs to be really helpful. A civilian deposit would mean that at some time you were working in a temporary position. We call them non-deduction appointments, right? You're working, but we're not deducting for retirement. You can buy that time back as long as your temporary appointment was before January 1st of 1989. Now, whenever we talk about buying something back within the federal government, the term that we use is making a deposit. So for those civilian deposits, we would charge you 1.3% of whatever you made in the job and interest. Making a military deposit, buying back your active duty military time to count towards your civilian retirement can be a really, really good idea. There, you have to typically, there's all kinds of exceptions, typically, you pay 3% of military base pay and we add interest on. Redeposit, you're working for the government, you're paying into retirement, but at some point you resign and you pull your money out of that federal retirement plan. You go do something else for a while, eventually you're reemployed by the government. You can redeposit that money when you come back with interest, of course. So again, the rules are still the same as far as making those civilian deposits, redeposits, making those military deposits. What's changing is the interest rate. So for 2024, the interest has gone up to 3.750. It was 1.875% last year. When I'm talking about making a military deposit, and I want to call out that one specifically, I taught a class this morning and I had a lot of people in there asking about military time, buying back that military time. We charge you 3% of your military base pay in most instances, and then the interest. Now, the interest starts 2 years after you enter civil service. It's not 2 years after you leave the military. It's 2 years after you enter civil service. If you don't pay your military deposit off in full, then you start seeing that interest in the 3rd year. It's cumulative. So this interest is variable, and we're talking about changes every year. So obviously this changes, right? Your interest is being added on top of interest. So let's just say, looking at this, I entered civil service in 2013. The interest rate back then was 1.625%. I have 2 years that I don't have to pay interest. So now I'm looking at 2015. They take 3% of my military base pay, they multiply it by 2%. We get a new number. The next year, if I haven't paid my military deposit off, we add another 2% on top of that number. The next year, if I haven't paid that off, we're adding another 1.875% on top of that number. And so that interest is being added onto not only my principal, but my interest too as I go through time. Set at 3.75% for this coming year. Another thing that's changing in January is our earnings limit. The earnings limit is applicable if we are receiving the FERS supplement or if we are drawing Social Security under our full retirement age of 66 or 67, depending on our year of birth. Drawing under that age or receiving the FERS supplement, we're limited in the amount of money that we can make from another job, and the number changes every year. For 2024, I'll be able to draw those benefits, work, and make up to $22,320 without negatively impacting myself. If I make more than $22,320, though, for every $2 I earn above the limit, they will take $1 away from my benefit in the coming year. Okay, so it's the limit that's increasing. The rules, again, all the same. A lot of times employees will ask me, well, what counts as income? None of your retirement, your civilian retirement, your military retirement, they do not count against you. Your pulling of IRAs or TSP or things like that doesn't count against you. Interest, dividends, capital gains doesn't count against you. Rental property doesn't count against you. Really, it's going to boil down to work earnings, right? Money that you get from a job. And that can include self-employment too, if you have a profit. So this is just a screenshot. I happen to take a picture of OPM's form that tells us what's included and what's excluded as earnings. Like I said, it applies to Social Security too. It's not just my supplements. Cost of living adjustments change each year. Now, these ones are announced in October. They actually become effective in December, but we don't see our December retirement payments until January. So that's when people actually notice the increase. COLA for this coming year set at 3.2%. So that is what military retirees will see added to their retirement. That is what you will see added if you are drawing Social Security. That is what you will see added if you are collecting a pension from the federal government under CSRS. FERS, however, does not pay out the full COLA unless it is under 2%. COLA under FERS, if the CPI is set at 2 to 3%, is 2. If it's above 3%, then it is 1% less than the actual CPI. So you can see right on my slide there, it is 3.2 for CSRS retirees. They will see that starting in January. For FERS people, it's only 2.2. And the FERS employees only get a COLA under 62 if they retire on a disability or if they retire under the special provisions of firefighting, law enforcement, air traffic control, customs, and border protection that is covered under the LEO provision. Those people get COLA the 1st January after they retire, if there is one. Everybody else under FERS has to wait until age 62 before they become eligible for any kind of COLA. Like I said, disability is the exception to that. One of the things that we have within the federal government, not only our FERS retirement, not only our Social Security, but we also have TSP, the amount that we can contribute to the thrift going up in January by $500. We will be able to contribute up to $23,000 regular contribution to TSP. If we are going to be turning 50 or older within the calendar year, we can put another $7,500 in there under catch-up. The catch-up is not changing. It was $7,500 this year. It's going to be next year as well. It's the regular contributions that went up by $500 or will go up by $500 in January. If we are working for someone else, we pay a Social Security tax that's called OASDI at a rate of 6.2% of each of our paychecks. our employer pays a corresponding tax as well. If we're working for ourselves, we're paying the 6.2 from the employee's perspective and the 6.2 from the employer's perspective. As we're paying that tax, right, there's a set amount of dollars that it applies to, and the dollar amount changes each year. It's 6.2%. That stays pretty constant. But for this coming year, we'll pay that tax up to a total earnings of $168,600. We make more than that, that tax stops once we hit this limit, and we would start paying it again come January 1st. If we are working and paying the tax, then we are also earning credits. Credits or quarters, that terminology can be interchangeable. It's absolutely fine, right? Means the same thing. I call them credits because when you call them quarters, you start thinking about time. And Social Security isn't about time. It's always about money. When I'm paying that tax and I earn a certain amount of money, I earn a credit or a quarter. For 2024, it will take $1,730 in pay to earn one Social Security credit. You can only earn 4 credits in a year, no matter how much you earn, as far as dollar-wise, and you need 40 of those credits, plus you have to be at least 62 before you can start collecting your Social Security. Now, when I start collecting my Social Security, they use the money that I paid in to calculate my high 35 years of earnings. And then they're going to multiply that by a 3-line formula. The formula changes a little bit every year too. So to calculate my benefit this year, Social Security will take my high 35, and that's called my average index monthly earnings. They'll take my high 35, they'll give me 90% of the first $1,174. They give me 32% of the next $5,904. They give me 15% of everything over the top of that. The 90, the 32, and the 15% stay the same. It's the dollar amounts that they are applied against that change each year. Okay, so trying as hard as I can to keep it to 20 minutes. I'm still unsuccessful, but that's okay. It's under 30 minutes. Hopefully really helpful for you to be able to see all of those annual changes in one place. If you are watching this on Facebook, please drop me a comment. Let me know if you have any questions. Let me know that you saw the video, what you thought of it. If you're watching it on YouTube, which is where it's going to live permanently, let me know that you watched it. Again, there too. Let me know if you have any kind of questions. I'm happy to answer. I am going to get more consistent with doing my lives in this coming year. That is a goal that I have set for myself, and I will get back to doing it once a week. Please, if there are specific topics that you would like to talk about or hear about, let me know. I am happy to get suggestions. It does give me ideas for what to talk about, because for me it's difficult. You know, I expect that everybody knows this stuff, and that's not always true. So I like the reminder that you would be interested in hearing about whatever that is. Okay? Thank you so much for joining me today. I hope you have a great rest of your day. Hope to hear from you soon.